Mepi program in Zimbabwe started at exactly the same time as the other 12 Mepi programs, and that was in October 2010. And we had, of course, put together a program, and to compete for the award, we had written what we thought was competitive. Now, when it was announced that we had won the grant, the question was now translating all the activities that we had described into practice. And that is not always easy, especially with a program as complex as the Mepi program. So the main challenge that I and my team, and indeed the whole college, faced at the beginning was to now put together a program that works, hire staff, address the internet challenges that we thought were critical to implementing the program, getting our committees together, because we had to obviously form committees to achieve our goals. So that was really the biggest challenge. I can't say that we were able to go through this overnight, but there was such a tremendous atmosphere at the college when we got the grant, something that everybody felt they could identify with. So it was possible to, within what I thought was a much shorter period of time, get most of these important milestones into play. The period running into the announcement of the grant was obviously a period of anxiety. We had a big team that consisted of University of Zimbabwe faculty and our partners, University of Colorado, Denver, and University of Stanford in the USA. And we were also in partnership with the University of Cape Town and University College London and King's College London and Bristol University. So you can see from my description that we had a fairly large number of stakeholders. So the first thing that we did was obviously to inform everybody that we had obtained the grant and to get people now to think of how to move forward. So email communication, telephone communication, face-to-face meetings, and we needed space, so identify space for offices and infrastructure, procurement of various things. So those are the really first steps that we took. I think one can identify a number of milestones and successes that I feel we have achieved. But I must say that the most important milestone and most important success that we've had is getting every key player within the college to recognize the benefits and the potential value of the Mepi program and getting everybody involved in one way or another. Students are involved, faculty members are involved, the support staff are involved, but even more importantly, the university leadership is now convinced of the importance of the program, and they're extremely supportive, and the Ministry of Health, Ministry of Higher Education, everybody is on board. I must say that even though that is not quantifiable, that's really the most important success of the program thus far. When we put together the program during the application period, we obviously had a monitoring and evaluation plan with certain outcomes in mind. Some, in metrics and others in qualitative terms. And this is now the end of the second year of Mepi, and of course we've been changing and improving and refining some of these outcome expectations. What I see really is something far beyond what we had anticipated during our M&E plan. There is such a tremendous desire for faculty members, for example, to train in medical or what you may call health education, and so many people have enrolled into the programs that we have put together that we think that we're really going to have a very strong faculty, much stronger than any of us had imagined by the end of the program. That's number one. Number two, the curricular change that is taking place will definitely result in better quality of education, medical education among our students, and I think that we'll also have a much stronger research team. And those are things that as we near the midterm of the program, one can see are achievable. Though those are some of the initial ones that I can mention, but there are certainly quite a lot others that we expect to improve tremendously by the end of the program. Right from my student days, and I guess everybody who has gone through medical school will realize that the library is a very important institution within the medical school. However, when we were putting together our Mepi program, we kind of neglected highlighting the importance of the library. That was, I guess, just an oversight on our part. But at the University of Zimbabwe, at the College of Health Sciences, I think we were extremely lucky. We had librarians who were really very jacked up. And as soon as they attended our initial workshops announcing the award, they approached us and they said, well, we are crucial players in the education of medical students and in the training of specialists. What role do you see for us? We, of course, apologized for not having really prioritized them. And from then on, we started engaging them very closely. They put together programs for students, for faculty, and they participated in our general workshops. There were training programs to improve retrieval, and they exposed us to a variety of resources, free resources, cheap resources, resources that could enhance many of our activities that we had absolutely no idea existed. Right now, various constituencies, various departments, various groups work through us with the library collaboratively to arrange for training programs, either on site or in their departments. So the library has become an exceedingly important component of our program. We hold, initially it was weekly, but now monthly management meetings, lasting an hour with the coordinators, just to make sure that the program is on course and to troubleshoot and so on and so forth. And we invited Masimba, our medical librarian, to attend a couple of these, and he has ever since come on his own volition. He's of course on our invitation list, but he has, whenever he is in town, he has attended these and made extremely useful contributions. I think we have a very strong medical library, and historically the medical librarians, the person I remember very clearly is Mrs. Helga Patricius. When I joined the college as a young faculty, she was always there. She assisted students, she assisted faculty. She went really beyond just sitting behind a desk answering technical questions. She really wanted you to get an appreciation that the library was a place that you could get much more than simply picking up a book or going to a desktop and running through a program. So that was a very rich history. And from then on, all the librarians at the medical school library have, in a sense, I guess, been strongly mentored by her and emulated whatever she instilled into them. When a doctor joins faculty in most of our institutions, they do so without any special training in medical education. The assumption is, having qualified from medical school, you had all the ingredients to be able to impart your knowledge to others. And we sort of bumbled along, and it's only in recent years that one realized that medical education is a whole profession by itself. You know, putting together curricula, choosing appropriate methods of instruction for different groups and different purposes, and working through the correct type of assessment of students, and so on and so forth. There is so much that goes into it. So clearly, that became, one would say, the elephant in the room. We had no way of getting this into our program. We did not have a medical education department, and we didn't have champions. But when Mepi came along, and this opportunity became obvious, and we were now able to link up with our partners who had very strong medical education departments, the University of Colorado and Stanford University, it simply lit up. It became possible for me and others now to really get this very important competence into our own teaching practice. So I really feel glad, and we are pushing this along. And so many people have come to this realization, and there's a lot of passion to acquire the basics, at least, of medical education. And there are few who obviously would like to take this up as an additional specialty to whatever subspecialty they are already practicing. So Mepi has been a game changer. There's been a game changer at the University of Zimbabwe. There has been a vibrancy in scholarship, in academics, in the way of life that people now see their role as educators and as students and as training specialists. So to me, I think that has got to be the biggest story. That has been a tremendous story at the University of Zimbabwe. The other 12 medical schools, I'm sure, have similar stories with different flavor, and I think I feel privileged that I'm part of this very strong, vibrant team that has got stories which will impact medical education and research capacity in Africa. But I think I must hasten to really thank the U.S. government groups that thought of putting together the Mepi program and funded it and saw it through. I think this has been something wonderful, and it's a program that, unlike many other programs which are run from U.S. institutions, is run by the African institutions. So the African institutions have been empowered, not just administratively, but financially. The funds come directly to the African institutions. A very unusual situation. And I think one has got to see that there is a paradigm shift. There is confidence in African leadership. There is confidence in the way Africans are able to manage. I'm sure that this didn't happen overnight. We've been working at it. We've been able to gain capacity to be able to put ourselves in this position of trust. So while thanking the U.S. government agencies that have brought about this funding, I also feel proud that we as African leaders, and here specifically African leaders in medical education, I think we have arrived. I happen to be lucky as a PI of one of the Mepi grants in that I have a fairly close association with 4 of the 13 medical schools directly because I was either a student there or, like in the University of Zimbabwe, I'm on the faculty. And most of the PIs of the other Mepi schools belong to other networks, research networks mainly, that I belong to. So we already knew each other and we interact outside the Mepi network. So it has been a very fortunate and vibrant group that has come together, and we're able to do a lot more simply because we know each other, we understand each other, and we're able to create a community of PIs that is able to push the envelope forward.